So much is happening and shifting in public health on a national scale and worldwide. But let's zero in and discuss what's working and what's not working in the communities that you serve. You're listening to the PHEC podcast, episode 407. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. Did you know that we've launched an app for this podcast? When we celebrated the 400th episode milestone, I knew it was time for something new and different. So we made the decision and investment into creating what so many of you have asked for, which is a special community without the distractions of social media or ads. The PHEC podcast community is an interactive digital space where public health professionals communicate, collaborate, rest, relax, and grow beyond the weekly podcast episodes. Here, you'll join a global network of public health practitioners sharing insights and resources and opportunities in a focused, safe, and healthy environment, free of social media distractions. Experience deeper conversations, direct access to industry leaders, and meaningful professional relationships that elevate your public health journey. Visit phecpodcastcommunity.com to join, or you can just download the app in either Google or Apple, either one. The app, again, is PHEC Podcast Community. So if you type that in the search, it should come right up. The links will also be provided in the description for this episode and also in the show notes. Make it super easy for you. Okay, on this episode today, we're sharing a conversation from a recent Public Health Roundtable Live, which typically occurs on LinkedIn during the first Wednesday of each month. I was joined by Dr. Dixon, so typically we'll have a panel of guests, but this time it was just Dr. Dixon and myself, and we basically were checking in on communities that we serve and discussing what's working and what's not, and started to encourage our attendees, some join live, some watching the replay, but to join in on the conversation and add to that discussion in the comments. So let's connect the Public Health Roundtable discussion right now. Welcome to the Public Health Roundtable live discussion or recording if you're watching the replay. My name is Dr. Charlotte Huntley. I'm joined by Dr. Dixon, and we are hosting the topic today of community health check-in, like what's working and what's not. With so much changing and as far as our critical programs and services being removed, completely erased, or the attempts to, it's a very frustrating time. It's a time where I don't think any of us imagine ever being at this place and moment as is a profession. But there's already a lot of information out there on the national level of what's happening and what's working, what's not. For the discussion today, I really want us to focus in on a check-in and discuss what's working and what's not regarding the communities that we serve. So as you're joining us, I want you to be thinking about the questions. I'd love for you to engage in the comments. It's really not just about the conversation that we're having here on the virtual stage, but join us in the comments and answer the question for yourself. Think about the communities that you serve and how they're being impacted and what's working and what's not. Before we dive in too far, let me officially introduce myself, and then I'll hand the mic over to my guest so she can introduce herself as well. My name is Dr. Charlotte Huntley, and I'm an epidemiologist and public health entrepreneur, bridging over 25 years of experience across healthcare and public health. And I do this by leading and serving in three ways. I primarily serve as a consultant, helping organizations understand community health needs through data storytelling. I also serve by uplifting BIPOC women through community building, and I also guide interdisciplinary public health professionals to successful entrepreneurship. I also am the host of the Public Health Epidemiology Conversations podcast and the Public Health Entrepreneurs podcast, as well as Tribal Epidemiology Center's podcast. All right, I will hand over the mic to Dr. Dixon. Please introduce yourself.
Thank you. Thank you, Dr. Huntley. And always impressive to hear everything that you're doing, that you've done. We've known each other for 3 years now, and you've just been a joy and definitely a force in public health. So thank you. Thank you for the introduction. Thank you for the chance to talk with you today. So I'm Dr. Ginger Dixon. I'm the founder of One Life Happy Solutions. And kind of as Dr. Huntley suggested, also multiple ways that I'm serving in public health as well. Primarily in the point that I really want to speak on today as we're talking about community health and their needs is I work in public health operations consulting, really focusing in on epidemiology, emergency preparedness strategy. My background is also as an epidemiologist. Before that, I like to say my past life, I was a nurse as well. And so, got a lot of clinical experience in working with individuals and kind of see healthcare and then seeing healthcare in the context of public health, I think has really given some unique insights as far as what individuals and what communities are needing and looking for and speaking to them and working with them to address those problems. And then we also, before in my areas that I have worked in, specifically have been local and state public health. So again, really seeing how we're engaging with communities, talking with people. I was on kind of the front lines during the COVID-19 pandemic and doing case investigations and just really getting to see how those operations complications emerged and what that looked like within our communities. So that's something that we strive to help with, is helping to address gaps or challenges with policy and procedure, working on modernizing our surveillance and really making those tools and resources available to a wider audience of our local and tribal public health. We also work to bolster our professional development through trainings in R and data science. And then we also work in youth education and really promoting at the community level the ideas of One Health, that intersection between animal health, the environment, and then human health and how they all interplay together. So it's been really, really rewarding.
Yes, thank you for that introduction. Yes, we have known each other for a long time, and I love the introductions. I think I pick up something a little different each time. So it's great. So let's kind of put our topic here on the screen in case someone joins us and they're trying, what are these ladies talking about? And again, I encourage you to join us in the comments, introduce yourself, chime in, responding to the questions, comments. We really want this to be engaging. And of course, we can't comment while we're live, but we definitely go to the comments after this ends and throughout the remaining weeks as you stumble upon this and join the conversation. I really do want to hear what's happening across other communities. Again, the topic is we are basically doing a community health check-in with everything that's been going on, especially here in the United States with the change of this new presidential administration. Everything has just been turned upside down, inside out. It feels as though we're under personal attack in public health. So I'm not really talking about, we're not recapping what's in the news and what's in our news feeds. What we're really talking about is just the focus on the communities that we serve. So I'm going to break it into two parts. Let's talk first about what's working. What are some of the things that are working in the public health community that you serve? And that is the question that I'd like for you to answer now. I'm going to start with just talking about two areas. If I think about public health professionals in terms of what's working, what I'm seeing a lot of is increased support among professionals across the industry. In other words, I see people sharing job posts, sharing resources, words of encouragement. It's been a greater extension of kindness. And I say a greater extension of kindness because I think that people who are in public health are already very thoughtful and very kind and very caring people. That's what attracts us to this world. But I think in these times, in these last few months especially, I've seen such a greater extension of kindness. So I would say that's definitely something that's working. As far as my nonprofit and government agency clients that I serve through my consulting business, I'm seeing a stronger display of courage and strength and determination, leaning into historical resiliency. I say that to put into context, my clients, my large nonprofit organizations are serving BIPOC organizations. So their leadership teams are led by BIPOC leaders, so Black, Indigenous, people of color. And I do serve and support a lot of tribal organizations. So when I say leaning into historical resiliency, our people historically have been resilient through unprecedented times in the past. And we still are dealing with that in the present on top of all the other things that we're talking about that's trying to erase public health. So I see my clients leaning into that historical resiliency, and it's showing up in greater levels of courage and strength and determination. And that's really encouraging me, and it's almost recharging me to work with them through these times. It's also something that I'm seeing leadership really becoming even more creative and innovative. And I'll even add to some of my government agency clients, they are really embracing some more creative and innovative measures as we navigate these really difficult times. So those are some of the things that I'm seeing across the communities that I serve that are working really well. And then I'll just add here a couple things that we're doing through my organization. We have some upcoming episodes of the Public Health Epidemiology Conversations podcast that are going to be very encouraging and supportive. I really reached out to some specific guests who are professionals in the field, and they're sharing insights and just really emphasizing words of encouragement and some actionable steps to take during these unprecedented times. So they really are sharing very actionable things that I know when I sat down to interview them and we went through the conversation, I left feeling very much like I had my marching orders. I felt very recharged and like a sense of clarity. So when these episodes release, I do believe this is something that will be a good thing. I count it as something that's working. It's a way that we're trying to serve and support the public health professional community. And then I will also add that recently, if you follow the podcast or follow my account at all, we celebrated 400 episodes of that podcast. And at that time, we launched a separate app for the podcast, PHEC Podcast Community App. And inside of that community, it's a place for public health professionals. Initially, we wanted to invest in, because we were celebrating that milestone, we wanted to invest in the community. And since all of the chaos that has been happening the last few months, we've really leaned into the space as a safe space, an environment for professionals to recharge. And we focus a lot on well-being and building connections. Just remembering that definition of health is not just the absence of disease, as we all know, but it's our physical, mental, emotional well-being. So we really focus in on supporting that part of us, because I don't think we really do that very well as an industry. We're so busy taking care of everyone else that we don't always think about ourselves. So that is what we're focusing on a lot in that community. So those are some ways that we're trying to show up and be a better resource during these times. So that's kind of a mouthful, but Dr. Dixon, I really want to hear from you. What are some of the things that are working in the communities that you serve?
Yeah, absolutely. And I can attest to the wellness and community that's building in that public health entrepreneurs app. And I love seeing pictures of Dr. Huntley's pea plants. If y'all didn't know that Dr. Huntley is also an accomplished gardener. And I'm impressed.
That's my backup career. I keep saying, if it doesn't work out, then I'm going to keep gardening.
That's our next coaching endeavor. I need you to come coach me as a gardener. But it really has. It's been wonderful. Just, you speak to resilience. I know being in public health, and as you said, being in public health to make a difference and care for people and really uplift communities, we definitely need to be mindful of uplifting each other. So I'm happy to see that work in that community as well. And I'm going to go do some more work in gardening for sure. But yeah, so to speak to what I've seen, again, I worked in local and state public health. And one of the things that I just find really inspiring and encouraging in this work is the amount of effort and emphasis that is going to speaking to communities, right? And getting their input in policies and procedures. And that's something that historically, especially for some of our marginalized communities, we're talking about our rural and tribal health communities, we needed to do some more work in that. So I've been really thankful to see that building. And even to see the way that we collect data. We're, as both epidemiologists, we can appreciate the way that we collect data, and the data that we collect, that also guides our evidence-based interventions, our policies, our procedures. So making sure that we're collecting data from the people that really need to get their voices out there and in a way that promotes that trust and transparency as well. We want to make sure that we're working with communities in a way that's comfortable for them. So I've been really thankful to see that just working in local rural health communities. I find that there's a lot of engagement from the communities themselves. The communities are calling public health and saying, hey, I saw this going on. What are y'all doing about this? They really want to be involved and they want to engage. And that's exciting, both as an opportunity for communities to empower themselves and as an opportunity for public health to decrease some of those fears when we have like outbreak events or emerging diseases. I talk a lot in One Health about diseases that spill over from animals to humans. We talk a lot about vector-borne diseases, especially mosquitoes. We get here in the muggy summers and the mosquitoes are coming back after the cold here in the United States. We'll start having more conversations about vector-borne diseases, especially having those conversations with the public and really encouraging that engagement. I think is a win-win for public health and serving our communities. So that's definitely going well. And there's opportunities as well to kind of train and deputize the public essentially to learn how to report that information in a way that public health can readily take and use and then show it back again in that we're talking about data transparency, show it back to the communities in dashboards or public facing surveillance measures in a way that they can see how what they're doing is helping. And I think, especially being in the community and being like, oh, I did that, I helped with this. That's exciting. And that's such a win-win for folks. So I've been thankful to see that. That's something that we definitely encourage in our strategy and in our surveillance work, in our consulting portion too. And then speaking more on, we talk about data transparency and dashboards and surveillance work. I nerd out on that stuff. I love talking about it. And especially I love the next step, right? I've been just so incredibly thankful to the people who, as public health has been, as you said, kind of attacked, and we've had to take down a lot of the data that took a lot of blood, sweat, and tears to gather. People have actually kind of gone through and saved that data and they just put it in another place. And so we've been actually in collaboration with MD Consulting as well. We've been kind of making a repository of where those data sets are so that people can still go back and access them. So when we still have that data, and now I'm excited to see the work that people are doing in translating that data. So not just showing it for the sake of showing it, but what are we going to do with it? And let's talk with our communities about what does this mean to you when you see this? When you look at this map or numbers or trends or what's going on, what stands out to you? What do you want us to do about this in public health? As much as public health professionals that are trained and experts, what we see is important as well. And so just that translation piece, I think, has been going really well and really focusing on data to action. As for example, there's a large overdose data to action program with the Centers for Disease Control and Prevention that has gone on at, state, local levels. And a big push for that has been exactly that translation piece. Let's get amazing data and then let's translate it for communities. So that I think has been fantastic. And then again, as someone who really advocates for, wants to promote this vision of One Health, of breaking down silos, of thinking in systems, of using, whole ecosystems, right? We understand that human health is not just in its own little bubble. We are also very much a part of our environments and the health of the animals, both our wildlife and domestic animals. So taking all of those pieces and looking at them together is incredibly important. And what's been going really well, when I started this business in 2022, right? My public health entrepreneurship journey that Dr. Huntley here actually helped me get started on. Thank you. We were still doing a lot of awareness about what One Health is. And I get really excited when I'm not doing awareness work anymore, really. When I hop on a call with somebody and I'm talking with them about what we do, they're like, oh yeah, I know One Health. Oh yeah, we actually had this situation and this was One Health and this is how we dealt with it. I'm like, yes. So, people, we're moving from that awareness to now we're really putting it in action. And with that, I think that's been an incredible opportunity for people to realize, how we need to work together, not only within our own agencies, but also across agencies and across silos. And so I've been seeing some fantastic work there, as far as breaking down, data barriers or communication barriers and really working together in a way that's more efficient and strategic. So I think those are my key things that's going well. I'd love to speak to.
Yeah, I think those are great. And I listening to you and I'm hearing this community theme and this sort of reminder that translation of the information, getting involved with the community. Even now, with the mess that we are in the middle of as a profession, we still have to remember the community because I think their perspective is different than our perspective. We're in the middle of it in a different way than the way the community is viewing. So any opportunity to get involved with the community and engage with the community is going to reward us exponentially. So just recently, I was completed a project that you assisted on, actually, if you remember the project we did. And it was, you and I did the analysis, we're excited about the report. But the most exciting part for me was actually attending the stakeholder meeting where I got to share the methodology. Now, fun fact, no one gets excited about a 40-minute presentation on methodology except, the scientists or the epidemiologists in there, right? But I really wanted to not use all of that time to just talk jargon. I really wanted to hear. And the engagement in the room was fantastic. And it was really, even now, the leaders in the room represented multiple different organizations around my state. So even as I listened to them with so many budget cuts and so much, really hitting them hard, those people in the room represented the true callings. They were called to this profession. They were there and they were rolling up their sleeves and talking about what needed to be done. And they were doing a deep dive with me into the data. Now, I did set an intention to make sure that I was communicating that. That was my goal. That's always my goal of a report. I want the person who's reading that to understand it regardless of their, whether they have a degree in public health or epidemiology or not. I want them to understand it and know what to make sense of it for themselves. So they were really dissecting it and really engaging. And, to your point, that communication, that empowerment, that is working right now because this was just last month. And like I said, every one of those organizations represented some sort of federally funded or grant funded structure that had sustained a lot of cuts because they definitely talked about it, but they were in there communicating and moving on. So I think just a reminder that community involvement, that communication, that translation of the science and of the data and the information, those things are still working. That's still working really well right now. So let's transition a little bit into discussing some of the things that are not working. While we could probably come up with a long list, if we think specifically in our community, I'd like to just kind of touch on that a little bit. And again, I'll kind of start. And you actually touched on emergency preparedness. And it's interesting because at this time of year, I think it's a mixture of things. I've recently worked on some client projects that involve the topic of diabetes. Diabetes is a topic I've often worked on over the years. Back when I was first starting grad school, it was a lot of the topics that I focused on. Recently, I've been involved in a lot of epidemiology-based projects around diabetes and also community assessments, trying to engage the needs of the community regarding or relating to that variable of diabetes. And then, of course, it's personal for me because I've been a diabetic for over 25 years now, and that's been a very personal part of my journey. So it's always been of interest to me. But I've been thinking about with the warmer summer months coming here in the U.S., this is kind of thinking about, well, especially in the South. So I'm in South Carolina in the Southeastern, I've got family along the Gulf Coast of Mississippi, and we're approaching hurricane season. I think officially kicks off June 1st and it's sort of like less than a month away. So it's kind of top of mind for me. So I started thinking about emergency preparedness. Like I have so many personal stories of either family members or myself going through hurricanes over the years. And when it comes down to people who have diabetes in emergency situations like that, it's a complicated concern. Like it's already complex with just the general population. But then when you start thinking about people who have chronic conditions like diabetes, it's even, like there's just so many more layers there. So it's just really top of mind. I wonder about with whole divisions of public health workforce being removed, I think about these vulnerable populations of people in these communities that are really at the high risk of hurricanes, the tornadoes, associated flooding. It's just really top of mind lately. I'm thinking to myself, who's assessing the needs of these communities right now regarding diabetes? Like, does this get lost with things that are being cut out and all of the dramatic cuts that we're experiencing right now, along with a whole list of concerns? This is the one that's rising up for me. So questions for me are like, who's looking out for them and their needs? Who's assessing their needs? Who's making sure that they have what they need? When it comes down to having to evacuate with short notice because of a natural disaster, for diabetics, I mean, there's like, you don't necessarily have all of your medication for very long periods of time into the future. then there's the issue of the machines, like the equipment, the glucometers to check your blood sugar. Like, how are they preparing their supplies? I just have so many questions. So this may be, you may see me in your news feed on all topics related to diabetes. And if that's a special area that you work in, please reach out to me through the direct messages. I would love to have conversations about this if that's a need that you target or something that you're working on. But that's just what I think about when I think about, what's not working. I just think when with whole sections being removed, we have so many gaps. And this is where, people that never really thought about us working in the background of what public health was, this is where it's really obvious that whole populations of people are going to just be kind of skipped over in vulnerable populations. So that's a real concern of mine. And if I can help in any way regarding this, like I said, you're welcome to send me a direct message. I would love to have this conversation and be a part of this type of solution. But for you, Dr. Dixon, and again, I remind everyone who's watching or paying attention to this, join us in the comments. We'd love to read your comments. But Dr. Dixon, the question for you, what are some of the things that are not working, regarding your communities right now?
Yeah, yeah. And I, will say, so I'm in like a drier Arizona state. So we're not as worried about the hurricanes. We do have monsoon every year that feels like, hurricane floods coming. But absolutely, speaking to one, hurricanes, two, extreme heat, and these other natural disasters that are coming about, especially as we're talking about changing climate and shifting patterns over time. I think a lot of my concern is that often in public health, and in all fairness, I feel like this in my own personal life sometimes. Sometimes we're just putting out fires, and we're going from one fire to the next fire to the next, and we don't really get a chance to like stop and breathe. And so I think one of the things that really stands out to me that we really need to work on in public health, and one of the things that we work on, in working with organizations on their strategy, is let's look long term, and let's look at being proactive, and building resilient systems and building in that resilience in our planning so that we're not just, jumping from one fire to the next. We're anticipating those fires, and then we're saying, okay, when that comes, we can also anticipate all of these changes on the back end. We talk about One Health. We talk about how the increase in floodwaters is also increasing those breeding grounds for mosquitoes. We talk about people being displaced in shelters, and animals being displaced in close proximity, and congregate shelters as well. So when do we even have the animals in our response planning? And are we anticipating those things? Are we anticipating that on the back end, after this immediate response, we're going to have other consequences from natural disasters like these and from the intervention measures that we had to take? So let's also build in that into our systems and planning. And then let's anticipate, that along with us as humans being displaced, we're also seeing animal displacement. And so we're going to see more potential risk for, spillover from animals to humans and those diseases that are coming about. I'll give an example, it really stood out to me. There was an increase in rabies outbreaks from foxes because of changes in the weather patterns, warmer winter, wetter winter, whatever, because the foxes weren't able to have their normal habitats and their normal patterns. Then we had this outbreak in rabies fueled attacks, we'll call it that. And then, a few years prior, we had an increase in hantavirus illnesses in humans because, we had a wetter winter, more rodents, people going to clean out their shed in the spring. And, like you go with the right mindset, you go to clean out. But if you are not aware of those precautions, we haven't really sat down with communities and made sure that we've gauged their understanding of what those precautions look like, and then made sure to fill in those gaps and understanding they're just going in there to clean out their shed, and then unwittingly contracting what can be a very fatal illness, And so I definitely want to build in more of that resilience, more long-term planning and prevention work, and so that we, even in emergency preparedness, right, we can get more on like the prevention side of things. And then I also, what I've seen And in my own experience as well, smaller local areas, they're doing a lot with a little bit. They're doing amazing things. As you said, they're getting creative, they're getting innovative. They are the experts in their communities. However, because they're doing a lot with a little bit, sometimes they have very outdated systems, of whether that's communication or surveillance, communication between professionals. Maybe they have fantastic policies and procedures, but they don't even know that they're around, or they're stuck in this like 50-page file, that nobody wants to read. And so how can we update those policies and procedures? How can we update those systems? How can we make surveillance, like quality surveillance, be more accessible across the board? Those are the things that I see as challenges going in and that we really want to work to fix. So I think those are the primary ones. And then as you said, that chronic care breakdown is so important too. So I'm glad to see, people like yourself and others here just making sure that we take care of that piece too. Because we know from COVID, like that was a huge breakdown, the prevention and chronic disease care. And that's just as important as those fires.
Great points. There's so much work to be done. I guess if I were to pull a theme out of this conversation today, it would really be there's so much work to be done. Yes, we do have a mess going on, but that doesn't mean the work has stopped or the needs have stopped and the needs have increased, if anything. I appreciate being able to have the conversation with you and hear from you. I really do encourage others to join us in the discussion, the comments. I know people are exhausted with this topic in a sense of it's very heavy with everything that's happening that's beyond our control or feels like it's, out of our reach. People are trying to recover and recruit from blow after blow. And then there's this increase in stress and anxiety and burnout because of morale is low, stress is high. I'm feeling it all. I'm not denying it at all. I think that how I am, approaching it is just, what can I do? Where can I fit in? How can I serve and help? That's kind of the attitude and the drive behind bringing this conversation out today. So thank you, Dr. Dixon. Thank you for all who joined us live and watch the replay. Of course, if you prefer not to openly comment, you're welcome to reach out to either one of us. Our names are right there on the screen. If you're not already following us, I encourage you to follow and hit the connection request here on LinkedIn and send a message and say, hey, I saw you on the live stream and I'd like to talk about this. Something to that effect. It'd just be great if you could reach out and connect with us. The point is that we would love to continue the conversation and see how we might be able to support you or your organization in any way, or just hold a conversation with a colleague who has wants to share an interest in something that we didn't discuss here today. Our DMs are open.
Yeah. Thank you. And definitely, I'd love to connect with folks, that are looking for ways to modernize, their operations, public health. And as we're wrapping up, I want to speak to, as there's a lot of work to be done, we don't have to do it all at once. We can definitely focus on, we take a really incremental approach and, let's look at the things that have the most impact, let's tackle those, and then move forward. And so definitely thank you. Thank you for the great conversation today.
Yeah, thank you all. And we'll see you on the next Public Health Roundtable. I really hope you enjoyed that conversation as much as we did. In the show notes, we've included a link to that LinkedIn live stream recording in case you'd like to add your comments and join that conversation. It is not too late, and I really encourage you to do so. The show notes page for this episode, which is episode 407, can be found at phecpodcast.com. Once you're there, just navigate to episode 407 to find its show notes. One more thing before you go. Remember to download the new PHEC Podcast Community app in either Apple or Google Play Store, or you can visit phecpodcastcommunity.com to join. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.